Did you know that 30% of our body's awareness of space comes from our feet? And it's responsible for the vertical balance of the body. So if there is any pain in this area, it could be leading to pain other places in the body. Some common conditions here are Achilles tendinopathy, plantar fasciitis, and shin splints. With that being said, an assessment of the foot is something that is really necessary. And when you're looking at the foot, you need to see if the pain is coming from there or somewhere else, and it's causing the foot to actually compensate for pain that is from the back or down the leg. Now, in the presence of rigidity or pain in the foot, this will lead to a decrease in the flexibility of spinal curves, which could be leading to more pain in the foot, stiffness in the back, stiffness in the neck. And this is something that you definitely want to consider as you're going through your treatment and getting into the foot. As we start in on the techniques for the foot, there's a lot of things to consider here. If someone has plantar fasciitis, is it truly that, or could it be tibialis posterior tendinitis? And if they do have a lot of pain on the plantar surface of their foot, what's causing that? How do we work around that? And that's what we're going to explore in this chapter of the course. We're going to start from the ground up. So first we're going to look at the foot. And with sports massage, you have to consider pre and post event. So pre-event, you want to do more stimulatory techniques. What I like to do is kind of reenact my old Thai reflexology moves. So just doing some nice wipes, doing some rolling on the foot. And you can even knock down the lower leg. And this just helps to wake everything up, wake up the nervous system, and make sure that the athlete is ready to go for the event. A common condition that athletes might have, especially runners, is plantar fasciitis. There's a couple ways to go about this. I mean, some people react differently. If you treat the area, some people will get inflamed and be more sore, but some also get better when you just go on that surface and do some techniques. So that's about communicating with the client and getting to know them over time, which is something that will just happen naturally, but it's good to test those things and see what works. I like to start off by treating the ankle. So along the Achilles tendon, a lot of the times the tissue here can get really tight, and that actually causes the plantar fasciitis. So with that, I'll get them to raise their leg up a bit. I'll take 2 knuckles, go on either side of the surface, and then spread down. And as I'm doing that, I'm just slowly moving his ankle as well. And you're just moving down into the heel. And for the heel, you can take 1 knuckle and go on the lateral side and then just spread the tissue down and open everything up around there. And it's nice to work on the foot because you can create a lot of movement yourself, which keeps the client more at ease. And just make sure to get both sides. You can even go right over the heel, take 2 knuckles, and then just spread down. Before I work on the plantar surface of the foot, I actually like to work on the dorsal side. And here I like to focus on the extensor retinaculum. If anyone's a dancer or does any type of ballet, things like that, or even hockey players, this is something where right here in the talus, it can get really bunged up or just really stuck. So for this type of maneuver, what I like to do is I'm gonna get Jeremy to bring his toes back, bring his foot back like this. And then what I'm doing here is I'm spreading out along the dorsal surface of the foot, and then I'm going to get Jeremy to slowly bring his toes down and then bring his foot down as I spread out into the ankle. And I'm just going to get you to stretch even more down like that. And this feels fantastic for anyone who has any tightness around the ankle or even plantar fasciitis. This is something that can indirectly affect the foot. I'm going to show you guys a little mobilization or traction too. This is more of an osteopathic technique. But what I'm doing here is I'm interlacing my fingers around the talus. And then, so as I do that, I'm taking my thumbs and I'm bringing his foot up. And then with my elbows straight, I use my body weight to pull back and traction the talus down. So bring him back up, and then traction as you pull with your body weight back. This is a really great technique. It's good to get some nice joint mobilizations in this area. It's something that some therapists forget to do. And I know in certain states, they're not allowed to do them. But if you are in your particular state or wherever you live, this is something you want to add into your treatments. I also like to do these kind of mobilizations just along the foot, in the arch. And you can go onto the lateral aspect. You're definitely going to get more movement here. And as you move into the middle of the dorsal surface, you're going to get a little less. And that's definitely what you want to feel and how a healthy foot feels. Okay, so now that we've worked on the dorsal side, we've done some nice mobilizations in the talus. After that, I like to get into this area on the plantar side of the foot. And first, I like to work on the lateral side of the foot, just opening everything up around here and around the toes. So I'll take 2 knuckles. And once again, I'll create the movement with my hand. And I'm just spreading down the lateral side, stretching everything out. And you can use a little bit of fascial cream. Right now, I'm actually just using my knuckles, no cream. And you're just looking at hydrating all the tissue around the lateral side of the foot, just so you get a nice complete treatment. After that, I like to take the toes, spread them back, and then I'll take 1 knuckle and just cross over along the metatarsal heads. And this is also one that feels really, really nice. And if you are working with someone indirectly and they can't take any pressure here with plantar fasciitis, these are all the techniques that you're going to want to do. So after that, for the plantar surface of the foot, you can warm it up with some nice thumbs, just get some nice circulation going in that area. You know, this area tends to be really tough, so it's something that you want to warm up, make sure that the person's comfortable. And then once again, I like to use knuckles, and I'll take the toes and create movement and then spread down the plantar surface. You can go at different angles, so start here, move down this area, and then go down into the kind of medial / lateral side. And you're just looking at these kind of active releases. Something to take note with the foot is that sciatica can actually be the result of the tibialis posterior. So the tib posterior tendon actually runs up the leg. And if you look under dissection, the sciatic nerve actually runs through with the nerve of the tibialis posterior. So one way to treat this is kind of locate the area here. It'll be quite a sensitive area, so you're definitely going to want to communicate with the client and make sure that they're comfortable. And you could use 1 fingertip, or you could use a knuckle if that's more comfortable. You know, I tend to use a fingertip because I like to kind of feel everything that's going on in the area, and I have strong fingers. You're just trying to release the tendon. So this is called a GTO, or Golgi tendon organ release. And you'll hold this for about 15 seconds to 90, and just waiting till you feel a little bit of a release. And you'll know once the tissue kind of softens under your fingertip. There's three common sources of pain in the lower leg. The first is a calf muscle strain, or more specifically, a gastrocnemius strain. This can occur during activity when you're about to sprint or take off, and oftentimes this will manifest as kind of a burning or tearing sensation. A calf muscle contusion often occurs after a direct blow or a series of blows, and there could be swelling, could be a lot of bruising in the area. There might even be a hematoma, a collection of blood, and you may even see that there's a discoloration in the lower leg. The third is a soleus muscle strain. The soleus lies deep to the gastrocnemius, and this is something that can build up for long distance runners. It's something that occurs over time. To trigger it, you can see if during knee flexion or during dorsiflexion of the ankle, if there's any pain that's recreated deep into that soleus area. When we're looking at the lower leg, there's a couple things to consider. Is the ankle pronated, supinated? And as you move up into the tibialis anterior, could it be tautness in that muscle that's actually causing a lack of mobility in the joint? And when you move up even further into the muscle, could the tibialis anterior have a trigger point that is actually leading to that knee pain? And when we're working around and getting into the calf, one thing to note is the soleus and how its strong contractions play a role in returning blood and lymphatic fluid back to the heart. Moving up into the lower leg, we have to consider the tibialis anterior. So for this, as a warm-up technique for sports massage, just some knocking down the leg is nice. Just creating circulation, waking up the nervous system. Another thing to do here is to go up the tibialis anterior. And with that, I like to take my thumb and just slowly move up the muscle. And you're only going at the rate at which the tissue allows you to move. I always found it good in my practice to not force anything. And I find clients respond better when you take your time and you're allowing your thumb to only go in and sink at the rate that the tissue is allowing it to move. One thing that is really interesting about this area is that when someone has knee pain, which is pretty common in any athlete, is the tib anterior right at the top, there's an acupressure or a trigger point. So when you get up here, right at the top, kind of where you'll feel the tibial tuberosity, you just want to go a little bit lateral. And you can take fingertips or your thumb and just press in there. And I've actually had clients who have had knee pain for so long, couldn't figure it out, went to the doctor, and just simply pressing on this area relieved the knee pain, which I find really incredible. One thing also with the lower leg and working in this area is that let's assume that someone has their ankle turned out like this. And that means that the tissue on this side, we want to bring that up to readjust his ankle straight, and then we want to bring the tissue down on this side, which is an old Rolfing technique. So Jeremy, I'm going to get you to bring your foot like this again. And then when I'm on either side, I take my knuckles and I'm just taking the surface pad right here in my hands. And I'm going up on this side and down on this side. So hands like this, and then I'm bringing the tissue up and down. And a good way to go about this is just doing it in different segments. And I've actually found that working directionally like this with tissue has been incredibly useful for clients. And once again, just following it up and down the leg. And you'd be surprised at the amazing results you get from working like this. Next up, we're going to talk about the calf. I like to treat this by getting the client to come to the end of the table, get their foot off the table, and then I'll take a pillow, just place it underneath their ankle. And the reason why I like this is that you can do muscle energy techniques, which I think is the best way to stretch any athlete. So what I'm going to get you to do, Jeremy, is I'm going to get you to press into my leg for 10 seconds. And then I'll get you to relax. And allow the client to relax for about 5. And then after you've done that, you could actually use the weight from your leg to push them into the stretch as you're working up the calf. And one thing to consider here is that with athletes, static stretching or putting them into a stretch, which is useful, but I just find doing these type of muscle energy techniques, working around the muscle yourself, doing that type of work has more use and actually leads to a greater stretch. So I like to open it up superficially first. So I'll take my knuckles on either side and I'll just pull down. And you're just stretching all along the side of the calf there in the soleus muscle. I'll take that down all the way into the ankle. To get more specific here, you can always I'm gonna have to come around here for the camera, but I like to take my fingertips, so I'll kind of elevate, kind of squeeze the calf in there, and then I'll just move up. And you're not putting a crazy amount of pressure here because this can be a sensitive area, but you definitely want to work out all those kind of crunchy bits and adhesions that are lining the calf muscle and the soleus. With the calf, muscle approximation is something you definitely want to consider too. Athletes just have a lot of tension. If they're runners, they're going to have a crazy amount of hypertonicity in this side of the muscle. So I like to gather tissue from the bottom and the top, right in the muscle belly, and then you're squeezing and bringing it together. You're just holding it just to get everything to relax. This is actually a great way to open up massaging the calves too. You can kind of transition that into raising the muscle belly off of the bone. And once again, this is just communicating to the body to relax everything in the area. Some nice, more like Swedish techniques here too is to take your thumbs and place them along the belly of the muscle and just work your way up, spreading all the tissue in between the midline. And then as you get higher up the leg, just spreading out laterally. And a nice active style release is, Jeremy, I'm just going to get you to bring your foot up and down slowly. So as the client does that, you can take your fist. And this is something that is easy on you as a therapist too. If you're going to be working with athletes, they're going to be usually quite muscular. So when you can drop your body weight down like this, it helps to just make your day a little bit easier. And once again, you can get them to even like circumduct their foot so they can spin it in a circle. You're just activating different fibers and making sure that you're getting a nice kind of overall effect for the entire lower leg. You're just hydrating all of the soft tissue, connective tissue.